Mary Polcheninoff, and welcome to Sure Things. Today's show, we're going to talk about the Westbrook Senior Center. Very exciting topic. We have a lot of information to share, so thanks for joining us. I'd like to introduce one of our speakers today, Courtney Burks, who's director at the Westbrook Senior Center.
Thank you.
And we have two members of the visiting nurses associated with Westbrook, but I know you'll clarify that more as we go along. Carol Saunders, Carol Mullaney, and Noreen Saunders. Thank you for joining us today, and I can't wait. We'll talk more about the visiting nurses as well as we get into our program. So welcome, Courtney.
Thank you. Thank you for having us.
Well, we're very excited that you're here today to talk all about the Westbrook Senior Center.
Yes.
To start, could you give us some background about the Senior Center?
Sure. The Senior Center opened in 2006, I believe. It was built with a small cities grant. And with that, there were certain rules intended for the buildings that was just used for the purposes of senior citizens, which is great. So every program that is offered there has to be specifically for senior citizens. So we offer everything from exercise, speaking, fall prevention, intergenerational programs. We do meals 4 times a week, exercise. So we have, over the past 8 years that I've been there, really developed very holistic programs to keep people safe and at home and in the community.
And did you say how long you've been there?
It'll be 8 years.
8 years,
Yep.
so you've been there for quite a while.
Quite a while.
And with the programming. So what changes have you noticed in those 8 years?
I've noticed really the constituents who come, the needs, the age. Now we don't have people retiring as early, so we have people who are still working who come for programs. They're looking for more holistic approaches to wellness, Tai Chi, yoga, nutrition. We do a lot of exercise programs. They really understand the value, and so do their doctors, about being safe at home, how to continue being independent. And I really see that transition in the past 8 years.
Yeah.
The socialization is huge. A lot of the people who come are widows. So they look for that aspect. It's a drop-in center, so you can come and join anything. And people will stay for quite a few hours after a program is done, little coffee clutches. So it really helps to fulfill that need for people who are looking for the socialization as well.
For people who are looking to get involved, is there an age limit, or when can you even?
The only requirement is that you are 60 or over.
Okay.
There's no
60.
membership. There's no dues. Anyone is welcome. We have our population of the Senior Center doubles in the summertime when everybody comes here. So that's great for us, and it's the same people who come back every year.
And they can just drop in.
Everything is drop in. Everything is drop in. We require reservations for meals just so we know how many are coming, but everything is a drop in. Yep.
That's wonderful.
Yep.
What about, can I just ask about the transportation then? Is there any system in place?
The only system we have is 9-Town Transit, the free shuttle bus and shuttle service in town. Unfortunately, we do not have our own transportation. That would be a daunting task. Financially, who do you pick up? What do you use it for? But unfortunately, people have to drive themselves. But we also have a nice network of people who will pick others up who can't drive anymore.
Oh, that's good.
Children will bring their parents in, neighbors. So it does. They do have that connection, absolutely.
So when you talk about that 9-Town Transit, that's pretty much on the person to organize.
Correct.
That,
they
to get
call,
the
and I believe it's a 48-hour notice that they need,
and they do.
And you can reserve it for, I think, 2 weeks. And if you know what programs you want to come to, they can drop you off, and there's a pickup window and drop off window. And if for senior citizens it is free, you just get a waiver, and it's a great service, and it's out of Centerbrook.
Oh, okay.
Yep. And it's all along the shoreline to use.
So how are you funded then? I'm curious about that.
We are funded through the taxpayers. I submit a budget every year.
Oh, you do?
Every fiscal year. It's a tiny budget. It's mostly our meal programs and instructor fees, which we don't have many of, but it's all paid for by the town.
Right. Yep. And you're located, you mentioned your building is grant funded, you're granted that that's the only use it can have, the senior center.
For seniors, absolutely.
And you
correct.
are where? Then?
We are in the lower level of the Mulvey School, the municipal center in town, where the town hall, where all the town offices are, correct.
So you're down in back there?
Yes.
And you have that whole system?
We have that whole.
Do you cook the food there?
We do.
When you the meal plan?
We do our own meals.
Interesting.
Yep.
Yeah. I was wondering too, because I know I was talking about my sister, and she's very much into. She goes to play this domino game there. What type of activities, or even I want to say clubs or groups that you have running on a consistent basis?
We have we have a group of card players. We have people who come to play games. Sometimes we just have drop-in where people will come with a group of friends and start playing bridge. So when I say it's a drop-in center, you can come right off the street with your friends and participate whatever you would like. Scheduled programs are our exercise, our yogas, the Tai Chi. Those are usually in blocks of time. But we consistently have the same programs, and then we'll have special speakers, fall prevention. So there's the regularly scheduled programs, and then there's the special programs. You know, like we're starting a new program in April for Parkinson's disease. So that's another initiative.
And what type of program
it's Dance with Parkinson's, and that's going to start in April. April is National Parkinson's Awareness Month.
And you'll be having dance?
Yeah.
Oh, wow.
Yep, and that's the whole program. And a lot of the programs we do are evidence-based, and they really show the research is there to show that these programs really work for certain populations.
Which goes right back to the community spirit and the connections that people make when they're part of that community.
Absolutely. And what I like about the senior center is generally, I mean, these women, their kids grew up together. They all went to the school, the Mulvey School. A lot of the people who still come to the senior center. So the generations of people who've lived in this town is really special, and you see it at the senior center. And you know, we have a whole group of new people who have just been, you know, really welcomed by the townies, and you know, it's a nice connection to have the history of the town, the school. It's just neat because you don't really have that in many places. They really know the history of the town, and they really appreciate it.
And I know it's interesting. You mentioned earlier that you don't have to be a Westbrook resident.
You do not have to be.
You can be from Clinton.
You can be from any
Madison,
town. Any town. We have people who come as far as Middletown, Niantic, Guilford. We run the gamut of the shoreline towns that come to programs.
Do you have a set number that you report, or a set number you get a feeling for the population, how many people actually use it on a consistent basis?
You know, we just did our budgets, and I want to say, I think we were averaging about 8,000 visits per month. I forget the number, but probably a good 8,000 per year.
And you notice too that goes up.
This has been the busiest year. Well, this has consecutively been the busiest year we've had in the 8 years I've been here. So that's great for us. And I think that a lot of people don't go to Florida like they used to. We have people who've moved here, who live here year round now, and that has helped our census stay up. Yeah, absolutely.
You mentioned speakers. What type of speakers would you get in?
We do everything for fraud, finances, end-of-life planning, fall prevention. We have
sometimes the physical therapist will come
Colin. I'm sorry, I can't remember his last name. Yeah,
Colin Morris.
Colin Morris. Pharmacy. So we do a lot of speakers that, you know, that they are asking for. That they,
relative
you know,
topics,
relative topics. You know, fall prevention with medications. What could be causing that? Spine health, knee health, shoulders, anything. You know, finances are a big one. We're starting actually a support group in March with Rebecca Kiernan. She's our licensed clinical social worker, and once a month she's just going to do, you know, a support group of aging, but different topics, and bring speakers in, and because that's a huge need that people have.
That's wonderful.
And that'll be at night at 5:30 on Thursdays, once a month, to also draw people in who might still be working, who don't have the availability to come during the day. That's been on my to-do list for a long time, to have a support group, because it's needed.
I think, and when you have speakers, are these in the evening usually?
Usually they're after lunch. That's our busiest time.
Really?
We've tried evening programs, and because we start so early and they like to be there in the morning, the evenings aren't our most popular time for programs. No.
What are your hours?
8 to 4.
Oh, it's 8 to 4.
Monday through Thursday, 8 to noon on Friday. Tuesdays we start early because we serve breakfast, so we're there at 6:30. But they're definitely a morning crew. Our group is. You know, I don't know how other senior centers are, but our group is definitely, they like mornings. So
it's interesting you mentioned other seniors centers. Do you actually communicate with others and have those regional type conversations?
You know, there is a organization, and I'm not a member of it, and I always forget to sign up for it. But we do call each other. You know, if someone says, "Oh, I went to Old Lyme and they have this great program," I'll call the director and say, "Oh, hey, how did you get that started?" Or, you know, the estuary is here in Old Saybrook, so we could share, you know, programs. it's always nice to see what other senior centers are doing, because it really, sometimes you just get in the routine and you don't think of anything new after a while.
You get some ideas.
Absolutely, and it's nice to see different things. Another initiative we want to start is art groups. They really want to have some, art lessons and things like that. So there's always change, and you have to change because it's their senior center, so we'll do whatever they want to do.
So you really go by their feedback.
Absolutely.
As well.
We do surveys all the time and say, what would you like to do? And, and sometimes they like how it is, or they have great ideas, even meal ideas. So and it's for them. So that's why we're there, and we do what they ask us to do. So.
Do you do trips?
We do not. There used to be a group in town, the Senior Citizen Club, and they used to do the trips, but they got very expensive, so the senior centers now collaborate together.
Okay,
so Madison and Old Saybrook are the hubs for trips now, because it used to be you pay as you went, and now the money is up front, so it's difficult for some people. But no, we don't do trips, and we don't have the transportation even for day trips.
No, but you'll get together and you might coordinate with someone
and
to get
they
that
do it
information
absolutely.
out.
Our Park and Rec department in town does trips, so that's a great resource for us to have as well.
What is your communication with them? Do you work closely with Parks
We do.
and Rec?
We're in the same building. They do some programs for us. We'll do programs with them, intergenerational programs. They have a very active programs as well. They do a lot of programs for seniors as well. They do an Eccentrics program that is extremely popular. So every department, is servicing the seniors the best we can.
So that's interesting. You mentioned that they also do the programs, and then you have your programs,
correct.
and then I think the Y also has
The Y,
some.
and they're a great resource for us too.
Right.
We share resources as well. We share instructors. What may not be popular for them might be a big hit with us, so they'll have people come to the Westbrook Senior Center. The Parkinson's program we'll reach out to the Y for, because they have a lot of people who are looking for that. So that's just a nice resource to reach out to people and say, we're going to be offering this if you know anybody. It's not a competition. It's just a resource. So we can help each other. Yeah.
Well, that's what I wondered with the communication,
absolutely.
if you can play off the resources you have.
Oh, absolutely.
So that you really can provide the services.
Absolutely.
For,
That's what you have to just
make sure you have that.
Absolutely.
How do you get your communication out about these programs and speakers?
We have the town website. I have a newsletter that I email or we hand out at the senior center, but that's how we do all of our advertisement. And the Westbrook events, that's a huge
what is that?
outlet for us. It's a quarterly magazine that goes just to Westbrook residents, and we talk about all of our upcoming events. It's a great tool to have to reach out to residents.
Westbrook events, great.
Yep.
Great, thank you.
You're welcome.
We will be back just after this short break.
Valley Shore Community Television is constantly adapting to the demands of our viewers. Busy schedules are making it hard for viewers to watch shows when they air.
Television has changed dramatically. We don't have to be appointment viewers or listeners anymore.
No.
We can do this in real time.
VSC TV has made it easy to watch all our locally produced content online and when you want it. Visit vsctv.com and click on the Watch Online tab to watch live, or visit our local show playlist to easily navigate your favorite shows anywhere, anytime, and on any device.
This world is for free. Freedom from the weight of this.
VSC TV is your local Connecticut Mid-Shore Valley digital connection.
Hi, welcome back to Shore Things. We're here with Courtney Burks and members of the Visiting Nurses Association of Westbrook to talk about services available in Westbrook for Westbrook residents and other residents as well. We talked the first part about the Senior Center in Westbrook and all the great programs they have. And now we're going to talk to Carol and Noreen about some of the visiting nurse programs and services that you offer. So welcome. We're excited to hear about what you offer and the type of services that you provide for people.
Thank you for having us.
Yeah.
Westbrook Visiting Nurses and Public Health is a small municipal agency that's been serving the town of Westbrook since 1927. And more recently, the adjacent towns of Old Saybrook, Essex, Deep River, Killingworth, and Clinton. Our mission is to provide the highest standards of professional service and exceed customer expectations in all services provided. and provide a public health program to promote the health of individuals, families, and communities. We are Medicare certified, we're state licensed, we belong to the town of Westbrook. We are governed by a 9-member nursing board, advised by a 6-member professional advisory committee. We collaborate with the town social services, with the director of emergency preparedness, the director of public health, and the director of the senior center. We provide blood pressure clinics, flu clinics for town employees and residents. We help obtain health speakers for the senior center. We provide town office visits and health promotion visits.
Carol, when you talk about your services and your clinics, where would they take place?
Town office visits would be anybody coming into our office.
Into
it
your
could
office,
be a
yeah.
senior from the senior center. Sometimes they stop in and would like their blood pressure checked, or sometimes we've had a couple of seniors recently who've fallen that we've had to call 911 for. Or on occasion, there might be a senior who cut their finger or, had a little cut, and they come to our office.
And they can, so if they're at the senior center, Courtney could say, could say, oh, by the way, write down.
Dial, yeah.
Oh, yeah. Oh, that's wonderful, though,
it's
in
great.
cooperation for that.
They're a flight upstairs from us, and and it's nice because when they do the flu clinic in the fall, if a resident is leaving to go to Florida before the flu clinic, they know they can just pop into the nurses and get their flu shot before they leave or come back. Like it's an open door policy.
That is
it's
wonderful.
awesome.
So when you say clinic, it really is in your office then? Like Courtney was saying, for a flu shot or something, they would just see you. Your office is also in the town hall building?
It is,
Yeah.
yes. And our hours are 8:30 to 4, and we are around the back of the town hall.
Okay.
There's a sign out back that says, a white sign that says Westbrook Visiting Nurses. So we're to the left of the main office in the back of the town hall.
And do you operate the same way? Would somebody need an appointment? I'd like to come in and get my flu shot, or I'd like to come in and get my blood pressure checked. Would I need an appointment to stop in that office?
Lots of times there's seniors that just stop in.
Okay.
But especially for a flu shot, it's always good to call ahead of time.
Yeah.
Because sometimes the nurses are out, and just to make sure that there's someone available to administer a flu vaccine. And we usually have the flu vaccine all the way through flu season till the end of March.
They do. Good, good. So I wanted to ask about the visiting part.
Sure.
So do you ladies then actually go into homes or service people in other locations?
Absolutely, we do. We go into homes for Westbrook and Old Saybrook, Essex, Deep River, Clinton, and Killingworth.
You do. And what type of services would you provide as a visiting nurse? I'm just
So we
curious what that
provide
covers.
skilled nursing services, physical therapy, occupational therapy, speech therapy, social workers, and home health aides.
You have connections to all those services?
Yes, we do.
Oh, wow.
Yes, and you would qualify for these services if you're discharged from a hospital, from a skilled nursing facility, or from a physician referral.
And would that be a charge then? How would that oh, you said that's covered. Did you say that's covered under
Well,
Medicare?
people have medical insurances, so
Yeah.
we would
Oh, so
bill
we
their
cover
medical
into that. Okay.
insurances. We also provide health promotion visits for the town of Westbrook.
Sure.
So if there's a resident in the community that there's a concern, then we could go out and make a town visit.
Okay, wonderful.
We have a 5-star rating for patient satisfaction. And in 2019, we were recognized as one of the top 25% of home care agencies in the
Wow,
nation.
that's awesome. So you must have, it must be a very busy caseload for the visiting nurses?
It is
In
very
Westbrook?
busy.
It must be.
And certainly there are times of the year when we are more busy than other times. But in general, yes, we're very
Yes,
busy.
yeah.
And we keep active.
Yeah. Oh, excellent, excellent. So that's wonderful. And then Noreen, you're also part of the visiting
so I do
nurses.
the physical therapy visits. So the home care visits are usually a bridge between when someone leaves a nursing home or a hospital, and to get them independent enough to either go to the senior center to do one of their programs, or go to outpatient physical therapy, or just be independent enough to not need any services at all.
That's wonderful.
Yeah.
So are you connected then to some of the other agencies? So if I was in a hospital and I was getting out, I'd be able to find out, oh yes, I can.
Yes, exactly. So
Okay.
this morning I did a discharge planning meeting at one of the local rehab facilities for a patient coming home, and it was a really nice way to get to know the patient and see what kind of equipment they needed and what kind of services. And then I did a home safety evaluation just to see what kind of equipment they might need, if they needed throw rugs removed or grab bars put in the house. And then when they, when we open the case, then we're all ready for them.
You're ready for
Yeah.
them. And just to follow up on that, because that's a very interesting concept, that going into the home and seeing how safe it is, like a home
That's
safe
a huge
visit.
part of home care. Yeah.
That is a huge part. So if I was a caretaker and I just wanted to have my house evaluated or my area evaluated for that, would that be a service I could actually, tie into to have you come
Oh,
in and
sure.
look
With
at
a
my-
physician referral, we
Oh,
usually
with
need,
physician referral.
Yeah.
That's very interesting because I'm sure as a caretaker, that's the first thing before someone comes in or comes home that
Right.
you want to make sure your house
Oh,
is safe.
safety's the biggest component. Yeah.
Right. Do you have an average amount of time you might work with someone with
about
PT
an hour per
services?
visit.
An hour per
Yeah.
visit, and then that might, and the length of time, weeks I'm saying, would depend
It
upon.
varies. The insurance is dictating us to be in and out a little
Yeah.
quicker, and we
Yeah.
have to be a little more efficient with our time. So generally, like twice a week for, we try 4 to 8 weeks. It depends on the
You do, okay, so
diagnosis
you have-
too.
you have a
if
certain
someone's had a
time.
hip replacement, it's not as long, or a knee replacement, because their window is short at home, because then
Yeah.
they're going to go to outpatient. They're a perfect candidate to move on to.
So you're really a bridge.
Yeah, we really are.
To get into that other services.
Yeah. And then we
Um,
do have, other cases that are more chronic. People who are sicker
Yeah.
might need longer services.
Long services.
Yeah.
So with the senior center, do you also come in and do the programs then? I
Yeah.
was thinking as Courtney was talking about some of the workshops and programs, how does that all
We
fit together?
started with our director of health. We started an initiative for fall prevention, and we continue every year, and we apply for a federal grant to pay for the equipment for people to take home, for the instructor who teaches. The program is called Tai Chi Quan, Movement for Better Balance, and it's based out of New Hampshire, it used to be called Mary Hitchcock, and
Yeah, Dartmouth.
Dartmouth Hitchcock Hospital. We do the research, we keep logs, we do assessments, we have to send all of that to them. I mean, this is evidence-based, and the progress these people make is phenomenal. And one of the other initiatives we did was for home safety was
At the election
Noreen
day. yeah.
followed a certain amount of home care clients, and obviously we kept it confidential, and we showed the progress that they made for fall prevention
That's
at home.
remarkable.
Yeah, so we've done a lot of approaches to keeping people safe at home. That is usually what we strive for, and there's always different ways to come up with a fall prevention program, and
Yeah.
the state is more than happy to give us the
fund
funding
that,
because we
yeah.
show the progress that they're making.
That's
and
awesome. You
it's
have that-
phenomenal.
that
So we
information.
will continue to do that. We
Right.
apply every October. And September is National Fall Prevention Month, so we always start in September. We do a big fall prevention clinic. Usually on election days when we do our fall prevention, we kick that off
Yeah,
with
we
the
do a free
flu
fall prevention.
Yeah.
flu
Wow,
clinic.
that's
So
fascinating.
we do that.
Yeah.
Noreen and I came up with a strength and endurance training class to improve balance, to keep people at home. So when they're done with therapy, they can come to the senior center.
That's wonderful.
It's just to
Great.
keep people independent and safe and strong.
You
And
have so many programs. That is awesome. I mean,
And it's really unique to have the collaboration to be
Yes.
right in the senior center. And
for such a small
great-
town, we have a lot of services,
That's
which
great
is
to know.
awesome.
So for people watching, how would they find out about this? You mentioned the website.
The website, they could call the main number for the senior center that's listed everywhere on the website, in the phone book, online. That's the easiest way, or they could just pop in if they
Pop
can
in.
drive
Okay,
over.
again, at
yeah.
the town hall.
Town hall. Mhm.
Yeah. Well, I want to thank you ladies very much.
you.
I feel like we didn't even cover everything, but it's wonderful, and I'm very, very proud to be in Westbrook that we have such great
Yeah, it's
services.
a great
Thank you. We
place.
appreciate that.
So
Thank you for having
joining
us.
us today.
Thank you for
Thank you once again, and I hope you join us again for Sure Things.